My name is Penelope.
I'm Jessica.
I'm Sydney.
I'm Bridget.
I'm Michelle.
I'm Liz Claire.
I'm Madeline, and this is our presentation on adolescence.
Adolescence is a transitional period between childhood and adulthood, characterized by rapid physical, cognitive, and emotional changes. Adolescence is categorized into three stages. Early adolescence is 11 to 14 years old, middle adolescence is 15 to 17 years old, and late adolescence is 18 to 20 years old. Puberty is one of the major milestones of adolescence, typically encompassing ages 11 to 14 and marking the development of secondary sexual characteristics and reproductive capabilities. On a cognitive level, abstract thinking and hypothetical reasoning develop during adolescence. Teens start to think critically about themselves and the world around them, often challenging societal norms and exploring their own ideologies. Adolescence is a crucial time for identity formation, often involving questioning authority and seeking independence. Peer relationships become increasingly important during this stage as adolescents seek acceptance and validation from their peers. Parents and educators play a crucial role in monitoring academic progress, social interactions, and overall development. On a more medical note, physicians and pediatricians monitor physical development and puberty progression through regular checkups. Parenting styles are closely related to adolescence, affecting the child or teen's behavior, self-esteem, and overall development. An authoritative parenting style characterized by warmth and reasonable boundaries helps encourage autonomy, emotional well-being, responsibility, and confidence during adolescence. This can help to better equip them for a successful transition into adulthood. Authoritarian parenting imposes strict rules and high expectations, limiting autonomy and emotional support for adolescents. This approach often leads to lower self-esteem, communication barriers, and difficulty in performing peer relationships. Permissive parents are lenient and indulgent, often avoiding confrontation and setting few rules. While this approach may promote a warm and nurturing environment, it can lead to a lack of structure and accountability in adolescence. Uninvolved parents are disengaged and neglectful, providing minimal support and supervision. This style can result in feelings of abandonment and low self-esteem in adolescence. This next clip from a Pixar movie, Inside Out, shows examples of some extreme mental, social, and emotional changes that adolescents go through as they grow and experience puberty.
What's puberty? I don't know. It's probably not important.
What?
Oh yeah, that sounds fantastic. I'm kind of nervous, but I'm mostly excited. Just shut up! Sorry. Okay.
Growth and development, talking about early adolescence first, this is 11 to 14-year-olds. This is an acceleration of growth and appearance of secondary sex characteristics like voice alterations, facial and pubic hair, and fat deposits, also the growth of primary sex characteristics as well. For girls, they're gonna have a growth of breast buds called thelarche, around 18 to 13 years old, and pubic hair called adrenarche. Their first period will follow 2 years after their breast buds and their pubic hair start coming in, around 10 and a half to 15 years old, called menarche. When adolescent girls experience pubertal delay, this means that their breasts haven't developed around up to 13 years old. For boys, testicular and penile enlargement, thinning and reddening, and increased looseness of the scrotum start to happen. And they also have an appearance of pubic hair and early facial hair around 9.5 to 14 years old. Growth spurts, girls start growing faster and sooner than boys do, around 9.5 to 14 years old, growing 2 to 8 inches and gaining 15.5 to 55 pounds. For boys, their growth spurts happen around 10.5 to 16 years old, growing 4 to 12 inches and gaining 15.5 to 66 pounds. During this time, they start to compare oneself with their peers to start figuring out what is, quote, normal. Their self-esteem starts to decline, and they start to assess attractiveness by acceptance or rejection from their peers. They start to define independence and dependence boundaries with their parents. They seek affiliation from their peers, and they're also struggling to find their niche in the group at the same time. They have self-exploration with limited dating and limited intimacy. For middle adolescents, 15 to 17 years old, girls' growth has started to slow down. They are about to reach their adult body weight. They start developing abstract thinking. They're involved in political, social, and philosophic problems. They modify their body image. They're more self-centered. They have conflicts over independence and control. They need a sense of identity to affirm self-image. They need acceptance from their peers. The conflict and independence, this normally happens with their parents. They start to have an attraction to the opposite sex or maybe the same sex. They start to have multiple relationships, starts finding and falling in love. They withdraw when their feelings are hurt or upset, and they have difficulty asking for help. Late adolescents, 18 to 20 years old, they're physically mature and entering adulthood. Their reproductive growth is almost complete. They have established abstract thought. They can view problems and work through them. Their self of identity has been established. Their body image and gender role is almost established. They have an increased self-esteem because they're figuring out who they are. Emotional and physical separation from parents is completed. Maybe they've moved out. Maybe they started traveling. This is also the time when kids start to move out and go to college. So they're starting to have an independence from their families. Peer groups, they start to reduce to more individual friendships, and that is valued more. They start to form intimate relationships or committed relationships with other people. They're also more consistent with emotion and more likely to hide sad or angry emotions. On the next slide, I have two charts from the CDC, one for girls and boys ages from 2 to 20 years old, looking at their BMIs and their ages at the bottom. BMIs are on the side, telling you around what percentile these children are in, which is useful in telling us if the children are delayed, on track, or ahead of their growth and development.
Gross motor skills are those that require movement and use of large muscle groups. In adolescence, the development of these skills present with improved coordination. Example of these skills that improve are coordination, balance, endurance, and strength. Strength showing up more in males. These skills are helpful for age-appropriate activities such as bike riding, organized team sports, and other physical fitness activities. Sports are especially important because adolescents are the age group that partakes in sports the most and helps build skills physically, socially, and emotionally. Fine motor skills are those that involve smaller muscle groups located in the hands and fingers. These skills are utilized in tasks that call for both control and precision. Growth spurts may trigger clumsiness in actions during early adolescence, which should resolve during middle to late adolescence. This leads to further refinement of fine motor skills, such as typing on a computer or working on more complex projects. Writing presents with improved handwriting, increased speed, and the ability to use different writing tools. Typing improves as seen on the computer and during text messaging. And then fine motor skills in the form of quick reflexes and use of precision are also seen during other age-appropriate activities, such as playing video games, graphic design, instant messaging friends, and operating vehicles. Here in this video, we can see a 17-year-old male perform multiple tasks that utilize both established fine gross motor skills, such as driving, playing sports, and partaking in physical fitness using reflexes and increased precision, in contrast to those of school-age children. And then moving on to adolescent milestones, there's multiple reach. We can see from early to middle to late adolescence. They go through middle and high school. They develop and establish abstract thought in which they can perform moral reasoning and decision making. They also struggle with depending on themselves versus their parents for performing daily activities such as personal hygiene, preparing meals, and other self-care activities. This struggle resolves as they enter late adolescence and resume more of a role in their own activities. Also, as they get closer to adulthood, their self-security with body image grows. For example, if an adolescent patient is dealing with a physical change such as a new scar or ostomy, it is important that their nurse acknowledges the struggle for feeling secure with body image and the patient's concern for peer thoughts or feeling embarrassed. The nurse should practice active listening and encourage positive affirmations, as well as shifting focus from these embarrassing feelings to more of the focus on the health benefits of something like an ostomy or other procedures.
The stages and levels of adolescence can be described in theories, such as Erikson's psychosocial development theory. This describes problems that individuals will encounter during stages of their life. In order to successfully move to another, the individual must achieve the favorable outcome. During adolescence, the individual will go through the identity versus role confusion stage as the adolescent strives to find their sense of identity among peers and in society. If unable to do so, they will become confused about their role in society. Nursing care includes involving the adolescent in decision-making and planning as they strive for independence. We would also provide education about safety, such as wearing a helmet, but emphasizing the danger and risks of not wearing a helmet, such as head injuries and facial injuries, because they tend to feel that they are invincible and nothing can harm them. Piaget developed a cognitive development theory. An adolescent would be in the formal operation stage. During this stage, the individual will be able to think abstractly, think at an adult level, and think beyond the present, multitask, have an increased attention span, and have a concern for others' needs and thoughts. Nursing care involves acknowledging that the adolescent is capable of abstract thinking, and this will impact the depth of patient teaching. Instead of providing the adolescent with just an explanation of the procedure, we are able to be more extensive. For example, a patient with appendicitis that needs an appendectomy. In this situation, we would explain the procedure and in addition explain why the procedure is needed and would benefit the patient's condition. Another factor to consider when providing patient teaching is that adolescents will focus on immediate effects of a procedure, so we need to emphasize the long-term consequences. For example, the patient that had an appendectomy may be concerned about how they will feel immediately after the procedure, but we need to educate about the full recovery process. Goldberg developed a theory on moral development, specifically how it develops in children. An adolescent would be in the post-conventional level. This level aligns with the formal operation stage of Piaget's cognitive development. During this level, the adolescent's behavior is determined by the general individual rights and standards that our society has agreed we should all follow. Even though there is an agreement that we should all follow the laws, adolescents are still able to acknowledge when laws need to change to meet the needs of society.
Puberty accelerates physical growth, which can double some adolescents' nutritional requirements, and at the same time, the need for peer acceptance, concern for physical appearance, cultural factors, and an active lifestyle can affect eating habits and nutritional intake. Based on the National Institutes of Health, adolescent females require around 2,200 calories a day, and male adolescents require 2,500 to 3,000 calories a day. For ages 14 plus, a 2,200 calorie diet consists of 2 cups of fruit. Examples of this include raw or frozen canned fruit, 3 cups of veggies, which can stem from leafy salad greens or 100% vegetable juice. This diet also consists of 7 ounces of grains. Examples of this include sliced bread or cooked rice, 6 ounces of protein stemming from seafood, lean meat, or poultry, 3 cups of dairy, which can come from dairy milk or yogurt, lactose-free dairy milk or yogurt, fortified soy milk, or even hard cheese. Next slide. As for a 3,000 calorie diet, ages 14 plus, the recommendations consist of 2.5 cups of fruit, 4 cups of veggies, 10 ounces of grains, 7 ounces of protein, and 3 cups of dairy. The recommended limitations for added sugars include less than 75 grams a day, less than 33 grams a day for saturated fats, and less than 2,300 milligrams a day for sodium.
This is a short clip that doesn't show every meal that adolescents may eat, but can be relatable for this age group. Like adults, they spend money on takeout food, snacks, and sweet treats. Many of these teens have extracurricular activities that make buying these things way more convenient. Some things teens have eaten over the past months include chocolate cake, Wingstop with the side of ranch, cafeteria food, apple juice, Doritos, a couple ounces of Coke, Raisin Canes, a ring pop, buy one get one free Subway, s'mores, a cupcake, cheese dog, more sweet treats like pastries and cookies, Haagen-Dazs vanilla ice cream, and the occasional strawberry. I know, shocking.
Going over anticipatory guidance, as Bridget mentioned, adolescence is a significant transitional period full of changes that can be confusing for both adolescents and their parents. During this time, adolescents usually go through detachment as they are learning to be more independent and seek more autonomy from their parents. To navigate this stage effectively, proper anticipatory guidance and health promotion are essential. This allows adolescents to manage their development while maintaining understanding and cooperation with their parents. Parents should lean towards an authoritative parenting approach which balances leniency while setting appropriate limitations. Parents should respect their adolescents' privacy and support them as they explore their identities. In order to reach a mutual understanding, this requires open and non-judgmental communication and mutual respect for the adolescent's preferences. Parents should also establish reasonable boundaries that ensure safety and well-being, such as setting a curfew at night, as well as keeping them responsible for the consequences of their actions when rules are broken. At this stage, adolescents experience growth spurts and puberty. Parents should encourage participation in sports or other physical activities regularly, aiming for about 1 hour of moderate to vigorous physical activity each day. This contributes to their bone growth and muscle development. They can also join sports teams in middle and high school, which will boost their self-esteem and communication skills. In this generation, it is common for adolescents to spend most of their time on technology. Being active instead of watching TV or playing video games will reduce the risk of developing conditions such as obesity. At the same time, this enhances their metabolic health and promotes better mental health by lowering stress and anxiety levels. Adolescents should also look for a sense of belonging and figuring out how to deal with relationships with adults and their peers. School plays a fundamental role in their social lives, and they may change their appearance or behavior to fit into a group. Adolescents with an illness such as diabetes might feel self-conscious or different from others. It is beneficial for them to attend peer support groups to let them feel that they are not alone and connect with others facing similar challenges. Confusion in sexual identity may also occur. It is important to listen and remain open-minded to them as they fear rejection or judgment. Ensure that adolescents can feel that there is a reliable support system available at times in distress and challenges. This can be done by letting them express their emotions and validating their feelings. This will foster familial relationships instead of driving them away. Finally, social media usage is common for this age group and should be taught about the dangers of cyberbullying and the importance of not sharing personal information online for their own safety.
Another topic to consider for anticipatory guidance with adolescents is monitoring their nutritional intake. It's common for adolescents to skip breakfast or eat snacks throughout the day rather than full meals due to time constraints. This can lead to risky weight loss practices and eating disorders such as anorexia nervosa or bulimia nervosa, which are very harmful physically and mentally. So, parents should help their adolescents with this through education, encouraging better nutrition at home, and helping them plan out their meals. Another risky behavior is substance abuse. Most of the time, adolescents try drugs because they are curious and want to know what it feels like. Other times, it can be from peer pressure. To prevent substance abuse or addiction, the best way is to discourage the beginning of it. This can be through peer-led programs discussing the negative social consequences of smoking. Adolescents tend to follow their peers, so if many of their peers are anti-smoking, it's likely that many will follow. These programs also discuss the short-term consequences such as bad breath, which are effective in preventing the beginning of smoking. Another topic for anticipatory guidance includes encouraging safety and preventing injuries within adolescence. The first cause of death in adolescents are motor vehicle crashes. This can be due to risky behaviors such as texting while driving, drunk driving, and being reckless. Adolescents have a feeling of indestructibility. Therefore, it's important to address these opportunities for injury by talking with the adolescent and educating them about avoiding distractions while driving, wearing seatbelts, following the speed limit, refusing to drive with someone who is impaired or driving recklessly, and more. Homicide and injury by firearms and other weapons is also a risk for adolescents because many report that it is easy to get access to a gun. So this is important for parents to educate their children of safe use and respect for firearms and overall monitor for children for any suspicious activity. Many adolescents also participate in sports, which has potential to cause injuries due to the aggressive nature that some sports have. So it's important to get proper instruction of the sport for the adolescent, provide protective equipment, promote safe behaviors in the sport, and encourage safety principles to prevent injuries such as fractures. Another risky behavior is sexual activity. Adolescence is a period of time where some kids might feel inclined to participate in sexual activities. They are riskier for problems such as sexually transmitted infections and sexual abuse. So it's important that safe sex is educated upon the adolescent age group. This includes information about protection such as condoms and getting tested to avoid the spread of any STI. It's also important to educate about consent. It can be easy for some parents to just tell their adolescent not to participate in sexual activities, but some adolescents will continue to do it. So educating and making sure the child is going about it in a safe and correct way is crucial. Another piece of anticipatory guidance that parents should expect is changes in religion and culture. In late adolescence, the child moves away from following the beliefs of the parents and starts to form their own beliefs and values. They are more inclined towards spiritual and ideological matters rather than strict religious customs. Encouraging an adolescent's exploration in religion and culture can be beneficial for them because they are proven to be associated with more health-promoting behaviors. All in all, the stage of adolescence is a sensitive period of time where the child is learning about themselves and who they are. Because of this, it is not advisable to control the adolescent's every move, but to carefully educate them in order to encourage them to make the correct and best decisions for their future. And these are our references. Thank you for listening.